I'm Melody, and we're going to talk about the dental hygiene process of care today. First part of the process of care is the assessment. When you bring your patient back, you're going to go over their medical history, which they fill out in the front office, especially if they're a new patient. They'll go over everything that they've marked yes on there and do a thorough interview on that. You'll take those findings, you'll record them on this sheet, which just talks about what medications they might be taking, and go write down any findings from your interview, and you'll take their vitals that you'll record up in this area or wherever it is on a sheet in whatever office you're working in. Take their blood pressure, their pulse, and their breaths per minute. Once you've done their medical history and vitals, and if they're okay to be treated, they don't need medical consult, then you can do your screening, see what they need for radiographs. You'll get your radiograph prescription signed. Dentist has usually the one to authorize radiograph prescriptions. This should be signed before you expose any radiographs. Once you expose your radiographs, you'll take them and you will mount them appropriately. These are ones I took on a model during my first year of dental hygiene school. His name was Dexter. After you expose your radiographs, you'll interpret them, and then you'll start your intraoral and extraoral exam for pre-screening for cancer or any other issues the patient may or may not be experiencing. You'll do your dental chart, what teeth are present, which teeth are missing, which teeth, if the dentist put a watch on them, you'll make sure those are still there. After you complete the dental chart with what is present and what is not present, you will do your periodontal chart, which is checking the pocket depths around all of the teeth, looking for recession, comparing recession to the radiographs for bone level. From there, you will fill out a risk assessment form based upon the patient's medical history for any risk factors for caries or periodontal disease that have to do with systemic or behavioral. You analyze their risk factors for caries lesions and then their periodontal risk factors, and you'll fill out what your patient's goals are, what interventions you'll use, and then the expected outcomes from that treatment. Based on this risk assessment, you may just be providing a prophy to that patient, which is totally fine. However, there's also a consent form for non-surgical periodontal therapy. You'll want your patient to read over this, sign it and date it, and you sign it as a witness. Depending on whether they're non-surgical periodontal therapy or regular prophylaxis, you will create a treatment plan with whether they're going to have an exam, what type of exam, any radiographs that were exposed, what type of treatment you'll be providing, and any other things that you'll be providing for that patient. I'll explain that to your patient. They'll sign this and they will date this. And then from there, you'll implement your treatment plan. You're going to show your patient any different tools for home care that would be beneficial to them. Different patients are going to require different home care tools. And then you will scale, and that'll be the end of that treatment plan. The last part of the process of care is evaluation. You'll bring patient back in a recare, whether it be 3 to 4 months, 6 months, 12 months. You'll update their medical history again at every appointment. You'll take their vitals if it's necessary. You'll check their plaque levels or their calculus levels and see what is and isn't working for that patient. You'll re-modify or demonstrate home care again, give them different tools, just depending on what is or isn't working for them. You'll record all of your findings again, just like you did at the previous appointment. That'll continue at every evaluation. Then you'll continue with your treatment plan, and that's the dental hygiene process of care.